Strack. I'm a pediatric oncologist and clinician scientist at the Insel Spital in Bern at the Department of Pediatric Oncology. We really started off with like a dream. So how would our perfect solution look like? And we sat down with CSEM to draft our idea on a board. Then step by step, we really managed to build this perfect solution. The team from CSEM looked at the points that we needed, and then they started building something. Then we evaluated it, tested the different options, and we said, yeah, this is nice, but maybe we can work a little bit on this. So it was a lot of discussions and listening to each other, what our needs are and what also would be possible from a technical point of view. Our vision would be that every child would constantly wear a device in the phases where it's most vulnerable to infections. And that these devices would then warn the parents and also the healthcare professionals that an infection is coming up a long time before it could be detected by other clinical signs that we normally have been using. And then hopefully that we could detect infections so early before they spread further, and so reduce mortality and morbidity to our patients, and then also, of course, in this way, have them spend less time inside the hospital and more time at home. So we have now a few patients already in study, and we've seen that they accept the devices and that they wear them well. They have access now also to some of the data on the app that was developed. I think what is very important is that the devices is very small, because small children, they don't like to carry anything around, and they don't want anything hurting or being annoying for them. They have their vital signs on the arm and maybe also connected to a cool watch. I think this is also something an older child would really like. And now we use mobile phones to transmit the data, and people are used to carry phones. And so I think this is also a very good solution. If the technology works perfect and the device is small and not a lot of extra work, then I think the families also stick to the study and to wearing the devices. By really introducing the Swiss Fever project can reduce stress, because parents might be assured that everything is all right. I think it's also not so nice for the child that always someone comes and sticks an ear thermometer into the ear. They might be sleeping, and the parents do worry, and that's very normal. I think we all would worry. But then if we provide them with the technology, they can just quickly check on their child and they know everything is all right. I think it would take a lot of pressure from them. That's still really the future or our vision, but I think everything starts with the vision. And I think that's where we are now, and hopefully in 10 years everything looks very different already.